Unmute the audio. Okay, welcome and good evening. We are just waiting for our attendees to join. So welcome to everyone this evening for our webinar. It's very exciting. I've got a few things to say by way of introduction just as people are coming in, but we have had such a terrific response to this particular webinar tonight. And just so you know, we have got a very diverse group of people, from acupuncturists, pain therapists, we've got cancer rehab people, chiros, podiatrists, psychologists, GPs, we've got orthopedic people, osteos, and post-op remedial massage therapists. So we're very excited about tonight. So let me just go ahead and share my screen with you so we can have a brief introduction. And this is our presentation tonight. We have got presentation about future-proofing your practice and using MLS laser therapy. So I'll introduce our speakers shortly. Let me just say at the moment that this webinar, just to introduce myself, I'm Catherine Norton. I'm the CEO of Heal with Laser. We have been in healthcare for over 20 years with experience in management, patients, and also business development. And one of the exciting things about MLS is that we've found it's a game changer for practices. We started the Practitioner Symposium series originally as a face-to-face meeting in Sydney that was scheduled for early May, but of course everybody's plans got changed. So we have revitalized these as online free webinars at the moment. In the upcoming weeks, we're going to be hearing from Dr. Bronwyn Cooper, who's CEO of Dr. Foot Solutions, as well as hopefully some other speakers coming up shortly. Tonight's presentation is at the end, we will have question and answers for you. Or if you can generate your own questions and answers. If you ask these as we go through, we'll take a look at those all at the very end. Now, MLS laser therapy, what we have found, it changes your business model. It allows you to deliver new services to your existing patients, and it also allows you to acquire new patients by offering new services. The thing about MLS laser, it delivers outstanding clinical results, increased patient satisfaction, and increased referrals. So those are some of the things we're going to be speaking about tonight, how you can incorporate this new therapy into your practice. Now, please feel free to take a look at our websites. Our website here in Australia is Heal with Laser. Our Italian partner and manufacturer is ASA Laser, and both of these websites provide a lot of information. You can find things like the range of products from portable units all the way up to fully robotized units, and even the brand new 7-diode fiber optic laser that's just been released. ASA Laser in Italy bases its whole approach on research and continuous training. So they're very scientifically based. There are articles and journals that they put out frequently. They have a campus that they are researching all the time, and they're very committed to training and achieving excellence. So that's the background to this whole approach to laser, and they call it a laser therapy solution. So it's not just a laser, it's not just a machine, it's not a device, it's actually a whole therapeutic solution that's being offered to practitioners. Now, the exciting part of the evening, I think most of our attendees have joined us now. We are very proud to be associated with this fantastic couple, Dr. Lindy and Pavle Kubrick from Sydney, and they're going to be speaking to us about future-proofing your practice. But also, I think the thing that will stand out to you is how you can achieve outstanding patient satisfaction with clinical and business results. And that's the thing that's most striking about Lindy and Pavle, is their focus on results. Now, we have got a unique combination, I think, of a chiropractor and a psychologist with a very strong background in business development. So it's a terrific combination to be bringing in new technology, especially into healthcare. And they're especially important because they are leading the way. I think this is what the future of healthcare and their chiropractic approach looks like for the future. They're passionate about their patients, so we're going to hear about that tonight. They're also committed to lifelong learning, so they are keen to keep learning, keep trying new things. And most important is their adventurous spirit, and that certainly will come out tonight. But I say that in all seriousness because the adventurous spirit is what's needed to take up a new technology like MLS laser. It's not for everyone. And I work with a lot of practitioners and they say to me, Catherine, why do I want to change? Why should I do anything different? So we're going to hear from some people tonight who are doing things differently. And I hope you will join me, sit back and listen to what they have to say. So I'm going to now ask Lindy and Pavle to join us. And if you would share your screen, and it's over to you. Thanks very much.
Good evening, guys. Just before we start, I want to thank Catherine for providing us such a safe place where we can talk, discuss, educate about cutting edge technology like a laser. So Catherine, thank you for organizing this.
And to summarize and make most of our time for today's talk, we'll be covering what laser is, how MLS is different and sets changes the game altogether, and also our story, because how we got here and what we're doing clinically with the cases I find really exciting, and I'm sure that you'll be able to apply some of those cases in your own practices.
Perfect. So what we're going to do is we're going to start with a quick introduction to what laser is. And for that, we're going to use a presentation. And the last time, I don't know how many of you had a chance to hear Dr. Kent, who was talking a little bit more about lasers. He's extremely knowledgeable and it had such a wealth of information. And I know that some of you did not have a chance to do that. So don't worry, in this short presentation, we're quickly going to run through some of the most important stuff before we come to the meat of presentation. Why we're doing that, we want everybody to be on the same page. So when we talk about the laser, some of the most important thing is to deal with preconceptions. Every time when we talk about laser, we see lights, cutting, explosions, we have Jedis there, and to some extent, yeah, that's true, but we talk about different type of lasers here. So laser stands for light amplification by stimulated emission of radiation. And first time when I heard that radiation, my ears were like, ooh, what's really happening there? So just to clarify that, I borrowed this from Dr. Kent's presentation, and it's very, very meaningful in explaining what we're talking about. You can see on your left side, we have a gamma rays and X-rays, which we actually don't like, and they're not good for our bodies. And then we have that little bit of a part, that's the light that we can see. It's between 400 and 700 nanometers. And medical laser operates around from 700 nanometers to 2,500 nanometers. So as you can see, it is light radiation, but it's completely in a different side of what we don't want. So it is extremely safe. And pretty much when we talk to our patients, the only thing that we want from them is to wear the protective glasses. The rest, they're completely safe. But having a light as something really beneficial for you, it's not a new concept. We know that Florence of Nightingale was one of the beautiful nurse who was actually proclaiming necessity of having a good hygiene and exposing a lot of her patients to sun. And guess what? People were getting better. There are sun hospitals, and things were like doing much, people are doing much better with that. So similarly, we have today something as a medical laser that uses the light with a different type of vehicle, providing the benefits. And benefits are on a cellular level. A little bit more later, we're going to talk about that, but most affected by medical lasers is mitochondria, and we're going to see how's that stimulating cells development. Furthermore, a very good book that can give you some good understanding, but also we provide that book and particularly part of that book to our patients to read. It's The Brain's Way of Healing. It's by Mr. or Dr. Norman Deutsch. And one whole chapter in that book, it's talking about ability of laser to heal people and to takeaway messages from there is that laser light, it's amazing in providing different type of cells opportunity to grow and to develop. So chondrocytes, osteocytes, and fibroblast cells are particularly involved in that process. And another thing that is very beneficial to our patients, and of course, we don't want to bug them with all the chemical changes and stuff. That's something that you guys want to know. But for our patients, the easiest way how we explain them is like, look, guys, like a plant, body needs certain things to heal, to grow. And what you need, it's oxygen, nutrients coming through blood. And that's exactly what medical lasers is providing. They're providing 2, almost 3 times more blood flow and all the oxygen and nutrients necessary for tissue development. And we're going to talk about that. But this book, it's absolutely beautiful. So if I am to summarize what medical laser is good for, like it's not good for everything, but what it's good for, we have blood, neurons, bones, muscles, connective tissue, joints, epithelium. All those areas are affected by a medical laser.
So when we talk about the benefits of laser, if you had to choose 3 points, you would talk about pain, inflammation, and wound healing. Now, as practitioners, we probably deal with mostly pain. I'm assuming most people are motivated by pain and go and see therapists, doctors, surgeons, specialists for pain and the help of their pain. That's the most common thing. And so if you can help someone with acute pain, chronic pain, post-surgical pain, musculoskeletal pain, which is what we mostly deal with, geriatric issues, you're going to find that the laser just blows that out of the park. Inflammation, again, when you have a pain, there's often associated inflammation, especially with any trauma or post-surgery especially as well. And so we find that this is such a great tool to speed up the process of reduction of inflammation. And lastly, something we don't deal particularly a lot with, we do some minor post-surgical wound healing, but you'd find that veterinary science is really big in wound healing. And, you know, an animal can't talk, but you can actually see the results of the wounds closing up. And there's some really good studies out there and pictures you can see where, you know, the speeding of that process. But particularly, again, wound healing would be great post-operatively. And dental use a lot of oral surgery. They're using laser for wound healing as well. So you find that these are some of the main points
Absolutely.
that we look at.
And just thinking about that, we actually had quite a few cases operatively, people would come to see us because, you know, some of them are not fan of taking a pain medication and they try to deal with pain different ways and just to reduce that inflammation. And I really like, because, you know, they would sit and they would work, laser would work on them, and they're like, well, why did you guys chose this laser? Like, what's special about it? Why this one? And I'm like, well, thank you for asking.
Good question.
A very good question, yes. So, like, why MLS? We know that medical lasers are particularly good for this type of pain, inflammation, and tissue regeneration. The reason why we did, particularly with MLS, it is in its name, and that is multi-wave locked system. What does that mean? Well, in therapeutic window, there are different lasers operating on different wave frequencies. MLS laser is the only laser that operates on 2 wavelengths. Why is that important? Well, 905 wavelengths that is MLS is using, it's extremely good for pain reduction and analgesic effect, whereas 808, it's extremely good and enhances anti-inflammatory and anti-edema effect. It's also within that therapeutic window that is extremely good for tissue regeneration. So instead of having to hop and like, oh, okay, well, today patient's having problem with pain, well, let's deal with this one, and then you can come for this one, you have 2 treatments in the same time. And for us, that was something very fascinating. And we found that our patients had the better results faster and long term. So what we have is in that simultaneously 808 and 905 are working. We absolutely love that. Also, not just that, there are about 7 other reasons that I found that I absolutely love, because we spent some time researching other lasers and medical lasers in general. Research is my background, so I was geeking out on that one. And I'm absolutely proud to say that our investment was the right one. So when we talk why MLS, there are 7 different reasons. And as you can see here, that would be a front screen, and they have a beautiful manual so you know exactly what is happening. But one of the most important things, it's safe. You see, there are different classes of laser. They can be from the simple pointers that would be class 1, and they go higher up with technically how much energy they are pumping through. And when we're already coming to class 3, class 3B, class 4, particularly class 4, it's a lasers that cut through the steel, it's laser, they're welding a metal. So we're talking about extreme heats. Well, guess what? When I heard class 4, I was like, wow, what is the thermal damage to this thing if things go wrong? Well, answer is none. This is one of very pivotal and very special, unique things that with class 4, you don't have to constantly move the area that you're working. You can literally live on the area without any fear of thermal damage, without any having cooling gels or wet towels just in case that you overheat the tissue. And that is absolutely giving a peace of mind for us. A second thing that is very good, and I think that Catherine already mentioned that, it's clinically researched laser. They have around 20 years of clinical research behind them, and that gives us a safety net. If there are some conditions that we're not quite sure, we can always go and check, hey, what is the latest research on that? And we absolutely love it. Next thing is therapeutic dosage. And that was one of the most concerning things for me when I was looking at other lasers. They have suggestion guidelines, but in this one, and I just took a photo of our little baby, that's the laser and that's the screen. You have exactly amount of joules that needs to be applied to a particular condition to create an optimal resources.
Some of the lasers, actually, you have to calculate the amount of joules you want. You have to do that basic maths, but it's time consuming to figure out the surface area, how much joules you want, how much energy, then what frequency.
It can be also hit and miss, whereas here, it even shows you which area to treat. And once when the optimal dosage is reached, automatically turns off. It's absolutely stupidity proof. Press it
easy.
and run it. And we absolutely love that. Also, it's patented system. It's perfectly controlled and it's always consistent. And we love consistency because consistency gives us reliability and replicability. And that's something that is very important for us and for our patients as well. When we talk about hands-free, there are 3 different options, and Catherine was mentioning a 4th. It's a baby coming to a family, although that baby, it's extremely powerful one, but it is hands-free. And our laser, it's this middle one. We absolutely love it. It does have a hand piece if you want to work on some particular spot in a detail, but other than that, you just set the settings, press play and just wait until it's done. So it gives you,
really.
Exactly. So it gives you some freedom as a practitioner to jump, do other stuff, potentially to see other patients and other clients while this is going. And we absolutely love that. Another thing that a lot of people don't think about it, but diodes need to be changed from time to time. However, good quality diodes very much differ from bad quality diodes. And this product, it's Italy made, and so they have a good quality diodes, long life, reliable, and that's something that you want to take into consideration. Lastly, but not leastly, area of treatments. We love to work with muscles, joint, tendons. There are presets, particular settings which are optimal for treating those areas. So when we talk about MLS, we talk about safety and reliability, and that's something that we really like.
So when we talk about how does MLS benefit patients and how does it benefit our patients, it's really a no-brainer, but I'm going to geek out with you a little bit. We're going to go through some of the biochemical changes. Now, when I talk to my patients, they usually come for a certain injury and I say, hey, you know, this is a mechanical injury, but there is some swelling and there is a lot of pain. And as much as we need to change the way that you move and change the way of your structure, this way your structure's hand is, we need to also change the biochemical effects. And so when we look at what the laser does, it has 3 effects: photochemical, photothermal, and photomechanical. Now, just to summarize those briefly, and I don't want to go into too much detail, you can dig real deep with this stuff. Photochemical, you're going to look at the increase of ATP production. And we know that when we increase ATP production, we increase the biosynthesis of macromolecules, we increase the speed of the active transport chain, the nerve transmission, propagation of the action potentials. We also help with growth and repair and movement of the muscle contraction, and also optimization of the sodium and potassium pump. So they're all under the photochemical branch. When we look at the photothermal, you're going to be increasing your circulation, and you're going to increase nutrient and oxygen contribution. And photomechanical, you're going to be seeing a lot of increasing the reduction of swelling or lymphatic peristalsis acceleration. I'm talking too fast, I'm getting excited, and microcirculation reactivation. So these three things, what that looks like for our patients is that we provide anti-inflammation for them. And obviously a lot of people come with conditions that are pro-inflammatory, and they don't necessarily want to be taking a lot of medications or anti-inflammatories, or you can only do so many cortisone injections. So this is a really great option for them. When we're looking at the analgesic effect, the statistics from the Australian Institute of Health and Welfare describe, that's our governing body for statistics, every day in Australia nearly 150 hospitalisations and 14 emergency department presentations involve opioid harm, and 3 people die from drug-induced opioid use. So we're seeing that there are people that are in pain, and this is one way that we can stay ahead of the game, but we can do it in a way that is safe, that is comfortable, and that will help your modality of what that you do in your business or practice or as a clinician. And then we go through increased vascular activity, accelerated tissue repair and cell growth. We're increasing metabolic activity. These are all great things when you want to speed up the healing process. Reduction of fibrous tissue formation, incredible for surgeons. Post-surgery, if you can reduce their swelling and stop that scar tissue from building up. I see a lot of patients that have a build-up of scar tissue, and not the surgery. Surgery's been great, but that scar tissue has been an issue. And so if you can reduce that, you're going to find that your patient outcomes will be much greater. Improved nerve function. You're not going to regenerate a complete nerve desiccation, like you're not going to help someone, but if you can improve the firing of that nerve, if there is some occlusion or compression, you can help with that. Stimulation of trigger points, really good as a chiropractor, physio, podiatrist, whatever, massage therapist. If you're doing stuff with your hands all day, we're going to get arthritis as we age. You're going to find that this prevents that, and you're going to be able to use the laser force for that kind of therapy and help your hands. So when we learned about the MLS laser initially, so a few years ago, we were like, this is too good to be true. How does it do? And we heard all these conditions it can help and treat. But I always say, if it's got an itis, you can help because there's inflammation. So anything like tendinitis, plantar fasciitis, arthritis is a big one that we see, and bursitis, so shoulder injuries where there's swelling and bursts or knees, all sorts of things, you're going to be able to effectively treat, and we just love using it on any itis. But then you're like, well, it helps wounds. Okay, great. Well, yes, it does. Then you find it's going to help with the trigger points, with your edema, your swelling, even like swelling from systemic conditions. You're going to be making a difference, and of course, muscular strains, sprains, and tears. So we find, and joint injuries too. So we find that there's multiple applications for, and it's quite effective in a lot of conditions because it goes back to the cellular level, and where your body's full cells. So if you can change the cellular level, you can change the conditions that it reflects.
Absolutely, and it was interesting when I first time heard that, and when both of us heard that, we were like, okay, what does that really means for us, right? And I was like, well, this almost sounds too good to be true. So what we did, we were like, okay, thank you guys. And actually at that time, that was 2-3 months in us deciding to work together. And as a husband and wife, trust me, it was 50-50. We knew that this can go like explosion, or it can be the best thing
we could
ever.
have a thriving business or have killed each other.
Or no business at all. But, we actually figured out that we can work very well together, feed off each other's energy. And I was like, well, look, I have psych background, and maybe we can develop more into that area. However, that was a chiro conference in Canberra coming up, so I would not mind actually going and just sussing out to see what's happening there. So Lindy was, okay, open, what's happening? She's like, okay, Pavla, I want you to go more management training.
And I want you to see what this laser stuff
and
is
check
about.
those stuff, and I'm going to go other stuff, and then we're going to meet, have a lunch, talk about it, go again, meet again, and talk about it. So I was on a mission, right? So I was going through seminars, and then we had the chance to hear about this. So I was like, Lindy, you have to come because it sounds interesting. But at that time, I played the cool card.
You
right?
did not play it cool. You were talking about it for 3 hours
True,
nonstop.
in the car. But with them, we played the cool card because I wanted to check. I had the 3 questions. First one, is it really as effective as they say it is? Second question was, how easy is to implement that, right? Because yeah, it can be implemented. Well, just how it's easy or hard to implement laser, because you know it might have a good results, but if I need extra work and it's hard to implement that, that might be a problem. And the third thing, I was thinking, how can we implement that with our modality that we're working off and with our patients that we have really liked it? So what we did is we spent a few months doing research, and we were like, okay, you know what? We have to check this one. So what we did, we got the laser, and within first 2 weeks, we said, okay, look guys, to our patients, we said, can you give us its anonymous feedback, and you're actually helping us. We need to know if this is working or not, right?
We've got this laser and we need to know if it
Simple
works.
as that. So there is, you're not doing us any favor by lying to us. It's anonymous. We don't know what is it. Give us your honest feedback so we know.
So we lined up a bunch of conditions and we treated them three times a week.
3 times a week for 2 weeks.
That was just our little trial period.
Exactly. And we're like, at the end of it, can you give us your information? And last question was, would you refer somebody to this type of modality in the future? And that was like a really, really important for us. And the feedback that we got was amazing. I'll just quickly read some of that. We have people pleasantly surprised at results, very relaxed in treatment. So remember, it's non-invasive. There's no pain. People sit there and they're just having less pain and less inflammation after that. They love that. Another one, mobility in my shoulder has totally improved and much better than I could have dreamed of. Another one, I did not feel as much pain or experience headache after the treatment. And people were loving it. Not just that, when we asked them, would you refer that? 70% of people strongly agree with the statement. Yes, we would have referred that to others, recommend to others. 17% agree with that, and 12% they were neutral. And that is okay.
What were the cases that we saw then? Because
well, there were different cases. So we had the elbow, we had back, shoulder, neck, headaches, some of the
listing body parts, rotator cuff injuries, lateral epicondylitis, ankle sprains, chronic neck pain and headache. So they were some of the cases that we we did an acute lumbar injury of a patient that is existing and come through the door. So there was quite a few broad spectrum cases that we wanted to see exactly the application of laser within our field. Yeah.
And we had such a good feedback, but guess what? It was not just a feedback from week 1. Our laser was paying off itself and bringing us profit. So they telling us that they love it and they're going to tell to others was actually true. It was investment for us, not expense. It was investment for us and it paid off and we never turned back. And honestly, the biggest issue in all that, and it's funny now looking like 2 years ago, a bit more, the biggest problem in all that was us. You know, it was our mindset.
Can I just share with my mindset? Because as a clinician, I've been doing something for 11 years and all of a sudden you need to change what you do or make a slightly different recommendation. And it was really tough at first. And until I became confident in the laser, and that was with a few months of using it, and I could say, hey, this is what you need and it will supplement what else we do. That's when I changed my mindset about my recommendations, about my confidence. It made all the difference. And
absolutely.
It just blew out of the park.
Absolutely. And just thinking about that now, retrospectively, there's 2 mindsets. There is surviving and there's thriving. And guys, MLS laser has nothing to do with surviving. MLS there is to thrive. So it was for us like that mindset where we were like, oh, okay, well, what else can we do? And you know, you just got that investment. You don't want to sink a whole bunch of money into advertisement. But I'll give you a little hint how we kickstarted our practice with pretty much $0 in any type of advertisement. We said, okay, we have sleepers. People who went through our treatment, they're happy, they're fun, and they're fine with everything. And we don't see them, right? How about we reach those people? How much does it cost to send them email or text message? Nothing. Then we have a people who, everybody has those people. They are in a chronic pain. They go from practitioner to practitioner. Not a lot of improvements happening. They're complaining. They're in pain. Everybody knows that. And they have limited results with everybody. And we're like, you know what? How about we contact those people? Because if laser makes difference to those people, everybody gonna know that because they tell everybody they're in pain. So we're like, okay, let's reach those people. And then we had the people, they're already going regulars in our clinics, and we just offer laser to them. So with those 3 groups of people, we're able to kickstart that, and we absolutely did not have any particular massive investments, but we had the beautiful results.
Yes, we did. So let's go through some of those results and some of those cases and how it might, it's benefited our patients, but I know that it can benefit everyone, a lot of patients, your patients particularly. So let's talk about, we all love athletes. They're the worst and best enemies because they just love to hurt themselves. An ultra runner, 38-year-old female, I'd been treating her for some general low back pain, but she was starting to train more for her ultra marathon. And she was dealing with a lot of repetitive strain, micro sprains of her hamstring. And so, we were working on the pelvis, doing biomechanic stuff, doing rehab, just retraining, glute firing and all that kind of stuff. But if something was missing, I was like, well, I've got this laser, I should try, should try it.
Well, it sits there.
So I made her, this was early on in the piece when we had just gotten our laser. I said, look, you need to try this laser. We'll schedule you for about 4 treatments and let's see how your recovery is.
Twice per week.
Twice per week. So we just did the 4 treatments in 2 weeks. What she noticed was, she could actually run the distances that she needed to without pain. She would still get some mild discomfort, but nowhere near the extent that she was. We did another 2 after that, spaced out week apart, and that was just a complete non-issue for her. Of course, she does continue running, and she's obviously biomechanically challenged because of the trauma and load. So what she does now is pre-race is she gets some laser to optimize her function, her circulation, and then post-race with some recovery. But generally now it's just more pre-race because she's
totally
so well.
hooked to that. She just wants more blood and oxygen in her muscles because it helps her with recovery, less injury. They can.
I think it's just part of her self-care for making sure she can do what she loves to do. So then we had another we had to choose from a few cases, a lot of cases. So PT, 34-year-old male, again, I treat his lumbar spine for, a past bulge disc, and that's under management. But he, as a PT, overuses his elbow. So he was starting to develop tennis elbow, so lateral epicondylitis. And basically he mentioned it, oh, look, for the last couple of weeks, I've been developing these symptoms. I said, let me have a look. I did some biomechanical work for him. The following time I saw him, he said, look, it's starting to get a little worse. I go, okay, we can't let this develop because once we get the tennis elbow symptoms, it's really hard to bring it back. Let's get you on laser treatments. We did 4 laser treatments. Again, we seem to find twice a week for 2 weeks initially works, and then we reevaluate at that point. So that made a huge difference for him, and he was back at training within 3 weeks, back to his usual weight. So we asked him to reduce his weight and also change some of his holds for a bit just so he could recover. But that made a huge difference to him, and now he's one of our biggest referrers for laser therapy. Another patient, another athlete, 67-year-old male, 67-year-old triathlete. Now, this guy is fitter than my husband sitting right next to me. He can outrun, outcycle, outswim Pavle. But that aside, he presented to us in 2018 with a right adductor injury. Now, he had, do you want to say the injury because you know the story well?
He didn't tell us what was
initially. Well, he told me he had an injury.
Yes,
he did say, but
yeah,
the way
of course. He said an injury. He didn't told us how he managed to get that injury. Well, story later on when we became like more friendly and talking and stuff. He was on his bike and he was like preparing for a race. So he was dashing. He hit the concrete pole. His shoes do not unclip, so he flies like with the bike, he flies on and his bike like just absolutely rips it and pulls him apart. And I was like, what just happened there? He's like, yep, can you help here? And we were like, okay.
So he injured himself 12 months prior to seeing us, and
Yep.
in those 12 months he sought lots of different type of clinicians and care, had heard about the laser and said, look, can we give this a go? Had even tried cortisone injections. That didn't make a difference for him. And so we did for him 3 times a week for 2 weeks. We stepped
Yep.
it up because he had a deadline. He was able to go through his race. He did really well. And he was just really amazed, which he then started to see us for other injuries that were lying in the background that he had dealt with, a shoulder injury.
Yep,
And then he had another injury, a fall afterwards, which pre-race again. So he, you know, as he does what he does, he falls off a bike or, you know, whatever, he's going to
Sure.
present with more and more conditions.
But
which
we were
can help.
so proud. He was like blasting everybody. Last year he had the triathlon, and he was #1 in his age category.
Yeah.
And he was super proud, and he was thanking us and thanking everybody that, like, you know.
So we say it was the laser that got you there for sure. So we all love the sports stuff, and a lot of people love, you know, especially in our chiropractic world. But you know what? We do see everybody else, particularly one case that was really, really interesting was a 62-year-old female. She's slightly overweight. Now she sits for work. She's an architect. Her right shoulder had begun hurting 6 months prior to us seeing her, and it was very quick onset shoulder pain. She had imaging which showed subacromial bursitis, and also when I was testing her, she's had a lot of subscapularis involvement, weakness and whatnot. She had done 3 and 5 months prior to her coming to our practice, had done cortisone injections. And she said that the first one made a slight difference, the second one made no difference. So she would try to do exercises and rehab to no avail because she couldn't actually even do them because of the amount of pain. Now, when she came us, she was in that category where I would say frozen shoulder. Wasn't officially diagnosed that way, but from seeing her range of motion, the pain levels, I would say that's a typical frozen shoulder presentation. Now, this was really interesting because the story was she was recommended the laser therapy by somebody who had told her about it. She went online and booked 10 sessions right off the bat, and I hadn't even consulted with her and told her how many sessions she may even need.
You know, and we were like, who's
this? Why am I getting these online bookings coming through? So when we had a sit-down conversation and I assessed her and all that, we actually put it together a schedule. But she was doing twice a week for 4 weeks. Within 4 sessions, so the end of the second week, she noticed a reduction of about 40 to 50% in pain. But her pain scale was a 10 out of 10. VAS was 10 out of 10. And she would have pain for 5 minutes with any kind of movement that would exacerbate her pain. So if she reached out or did some kind of a twist through her shoulder, it wasn't even an overhead motion, she would be in a 10 out of 10 pain where she would be in tears. So it prevented her from doing her work properly, and she was at wit's end about that. We were able to check, I say laser was able to make that difference for her. And now she's driving over an hour away for treatment just to get that. So now she just sees us every 5 to 6 weeks for a top up. I've told her she could cease care. She's pretty good. She's like, no, I want to make sure we're on top of this because, you know, she's PTing now 3 times a week with a personal trainer, has lost some weight, and she's very pleased with her results that she could be able to do that. So again, another athlete. I've got a few athletes because they're the most sort of like big wow stories. 18-year-old ballet dancer, female, and she's also a dance teacher. During COVID, she was sitting on her bed doing some work, legs extended, about for an hour, stood up and fell to the ground. She's a fit, gorgeous, petite young thing, but she had presented with a sartorius grade 2 tendon tear. I sent her to a GP to get some imaging. GP said, no, don't worry, just keep doing what you're doing if it doesn't improve in a couple of weeks. So we didn't actually get the ultrasound, but we do know that she improved after 6 laser sessions. So she was able to return to like online dance because they were doing online classes, back to tutoring online. And she could stop the use of her crutches after that, and now we were just working on biomechanical. But I don't think that if I hadn't done laser therapy that she would get those results. I think she would be struggling a whole lot more. Yeah, for a much longer time period. And I wouldn't be able to do some of the work I did mechanically on her to fix some of the deficiencies in her hips and knees if we didn't do and apply laser therapy. Another one, a dear patient of ours, an 81-year-old female, had a left knee replacement in 2017. We saw her May 2018. She had her surgery was a very successful surgery, but it highlighted other deficiencies because she had severe arthritis throughout her whole spine and lower limbs. And so she started to get recurrent hamstring tears. She couldn't walk properly, creating some hammer toes as well. And so basically she was at wit's end because she thinks it was a surgery that had got her to this point. I told her it's definitely not. It's just now you can see your knee's no longer in pain. You can actually feel everything else that's going on. And so we actually got her moving. And now she's basically, that's first person that called us during COVID. We were still operating, but she's like, I need to come back. And, you know, when it was sort of the numbers were starting to come down. So she just wants to manage her osteoarthritis. Like I've told her, I will never be able to reverse your osteoarthritis. I can just help you manage it. And she's like, oh, Lindy, I just want you to just keep at it because this is the only thing that keeps me going and it gets me out of the house. So she's just constantly singing praises. And it's just a nice feeling because, you know, we still do chiro work with her, but she loves the laser. It's gentle,
improving the quality
non-invasive.
of life for that lady.
For sure. Now I could keep talking. There's a couple of patients here, knee osteoarthritis. I was managing this patient in our other location where we don't yet have the laser. And we were getting on top of things and then she just had a few falls and we couldn't bring that swelling down on that knee osteoarthritis. Her knees were as big as, I don't know what you'd call some big mango or something, bigger than that. And no matter what I did, exercises, rehab, gentle stretches, taping, obviously chiropractic pelvic alignment work, nothing was helping her. I said, you know what, you need to come over to our Castle Hill practice and you need to do lasers. I want you to commit to 6. After her first visit, she's like, the swelling's down. I go, please, just don't get that excited. I know you want to believe. And I believe she did feel a difference, but after the third visit, we couldn't see the swelling as much at all.
Absolutely.
So she has bursitis. She has some meniscal damage, but we're mainly treating her for the soft tissue around the knee. So now she's under rehab care and she's getting stronger, which is going to allow her knees to obviously function a bit better. We also have do you want to talk about, I don't want to mention the name, the arthritis?
Absolutely, and we love this. They're going to come to you with one injury, right? Doesn't matter. In this case, a lady just fell down and her hand went first, so she injured her like middle finger, and for like 5 weeks it was just painful, swollen, and so she's like, guys, can you help?
I treat this lady for pelvic and coccyx pain. Yeah.
Yes. So we're like, sure, of course, we can help with pain, inflammation. I did one session there. We're just talking, what else can it help? And like already next time she mentions that she's having some like arthritis in her hands, in her thumbs. And can I do something? So I'm like switching from one spot. I was like, okay, I'm gonna do another spot. Then like week after, like, oh, this is so great. But now other hand is hurting. So I'm like, okay, fine, we're gonna do 2 hands. And then at the point where she's like, well, my feet is also hurting. Then I was like, okay, yes,
We
sure.
talk about a treatment plan and what we actually need to do now.
Let's recreate the treatment plan. But many times you're gonna find out that you start with one thing and they just keep adding, which is good. They see it's working.
They see the value in it.
Absolutely. And another bread and butter for us, it's headaches, migraines.
Look, if you can change someone's headache and migraine, or
it's crazy.
You're going to be their savior. That's
Absolutely.
not. I don't have a God complex at all. But what you'll find is that laser is such a great look. As a chiropractor, I think I deal with headaches pretty well biomechanically, and I'm sure all clinicians out there, you probably deal with all the cases that you see, but you're going to find that if you do this adjunct therapy, or I think it's been part of what I do now, it's going to blow your results out of the water. And we're just getting migraine patients and headache patients are some of the first people that wanted to resume care during COVID.
Absolutely.
For example, I'll give you one really good example. My mother is probably my hardest patient. Now I treat her, and I've been treating
Mother-in-law is the always hardest case. We all know that.
I've been treating her for forever. She's been getting chiropractic care for as long as I've known. And she gets chronic headaches, and I usually adjust that and do soft tissue work, and that makes a difference for her. She'd have laser therapy when we first got it because she had a hip replacement, and we know it made a difference. It reduces swelling, improved with the scar tissue, but she had nothing else to compare it to. So in her head, yeah, it helped. Anyhow, she calls me not long ago and says, Lindy, I've got a really bad headache. I can't move my neck. I'm in so much pain. I said, Mum, I'm booked out today. I can put you on the laser though. That will help. Oh, okay. All right. She comes in for her laser therapy. Leaves about 3 hours later. I get 2 missed calls, and I'm like, oh, I can't deal with this now. Call at the end of my day. Mum, how are you? Is your headache okay? Are you bad? Why did you call me? You must be in so much pain. She's like, it works. I'm like, what works? The laser. I'm like, well, thank you for telling me. We've only had it for 2 years and now you're telling me it works. Of course it works, Mum. Why do you say that? Well, with the hip, I knew it helped, but no, I have no pain. I'm like, well, of course you have no pain. This is what it does. And I, re-educated her. Can I have another one to make sure it works? I'm like, yes, you are booked in for next week. We are going to handle that. We'll do that. But I don't want the chiro stuff. I want to see if it's laser and if it makes a difference.
She's a good researcher.
That's her research. So look, sometimes, family the hardest buy-ins, but when they do buy in and when you show them how effective it is, you're going to find that
they're the best converters later. They tell to everybody, but at the start it's hard. One of the big things when we talk about laser is and for us this was a journey thinking about that. There's always 3 questions that we want to answer when we try to include a new modality in our practices. And question number 1 is, how big impact do you have on your patients and on your community, right? And we all wish to have a big one, and we all hope so and work toward that. But for us, it's a question, okay, if we close tomorrow, how many of our patients going to be like, oh yeah, we like them, but yeah, just move on, right? And for us, having a laser really gave us edge. It's not competition, but we have something that can help people while they have acute pain. We can help people where they have chronic, and it really helped us with our confidence. Second thing, how engaging, how really interesting is our interaction with our patients, our community. And you know what? Hard truth for us, it was that, newsletters, we send them like, great news, exciting, we have, I don't know, off for this deal or this, that, and stuff. And you know what? That's actually not exciting. They have been bombarded every day with those offers. Those offers are not exciting anymore. But when you come in and say, hey, we have a modality that can help you change you, get out of pain. These are the cases that we have. It's exciting. If you have somebody with this type of injury, you can recommend this. Come and try. That is exciting. You're creating something that is, wow, it's different. Wow, we want to check it out. It's cutting edge. It's laser. Wow. What can it do for me? What can it do for somebody that I know and it's with that pain? And the third question is, are you seen as a leader, as a culture changer in your field? And MLS can help you to jump that and to jump at the front and actually be that. So you know what, guys? Go and do your research. But from everything that we had and that we experienced, we're giving you our story and like bits and pieces how we did and what it did for us. And also at the end of presentation, I want to thank Catherine. If we ever needed any information, any guidance, skilling up, technical specification, and God knows I'm pained when it comes to those things.
Yeah.
She was on the ball. Not just that, she provides opportunity, somebody to come in to take photo of you and the laser, to take a little video of you and the laser. Do you know how important it is when you're creating something, when you're introducing your patients so that they see laser in the environment that you have, when they see you talking about laser, it is absolute gold. And she does that. So Catherine, thank you for how well you taking care of us. And it was really very good and very beautiful journey for us. And I hope that other people are going to have the similar experience.
So we'll hand over to Catherine so we can answer the questions all together and
absolutely
do all that.
I know how much questions were important for me when we were learning about laser. Yep. We see a few questions, and guys, feel free to send us questions during the presentation. I have seen a few raised hands. We do apologize, but sometimes when we allowed people to talk, they have a crazy reverb, and it's a little bit bad for everybody. So please type and send us your questions, and we're gonna have to answer.
Thank you so much. That was just really awesome. And with the couple of the comments there are wonderful presentation, and thank you for the presentation from the attendees. So especially after a busy day at work, I know you had a very big day, to still have this energy and enthusiasm for what you do is very inspiring. And I really like those 3 questions that you get people to think about. They're very
We're looking at them, I think they're brilliant.
Yeah, important questions that I know I get all the time, and they're hard for people to really face up to. But how about we take a look at a couple of these questions, and you want to take a look at the first one there, Lindy?
I see Tim Wade Farrell. Hello, Dr. Tim. Awesome presentation. My question is, do you follow the preset settings, or do you set the treatment dose manually? And if so, what was your guide to decide the settings? I often find I need to mix setting parameters, but know of practitioners who only follow the presets. So short answer is, initially we started with presets. And then the more that we learned, we started to explore and expand. Now, not everything, I mean, there are some conditions which you won't find in the computer.
So you have to infer.
So you have to infer. So if it's a superficial thing, you'd be doing like a hand setting. So if you're trying to do like TMJ, I'd be doing more like a hand setting on that.
Not a lot of tissue there, it's quite surface.
But also we look at other guides, and you can find a lot of things online as to, some people will discuss, hey, this might be better for this. And so it is, because laser therapy is something that in Australia, at least, it's still coming to be known. We're still learning all the time. We've gotten people come with certain cases, like a person booked online for a cold sore and said, I want a cold sore treatment. And I said, we're a musculoskeletal clinic. We don't deal with cold sores, right? And she's like, no, I was overseas, and a GP, a Spanish GP, told me he does laser in his clinic, and he wants me to do because I get recurrent cold sores. And she's a fitness model. And I said, look, I don't know what I'm doing. Let's research it. But no, I really want it. No one else is allowing. So we went online and went on and did some research, and there was information about, the herpes simplex.
Absolutely.
And so, we had to figure out settings for something like that. And we said, we're going to not really charge you much for that, because this is just a trial for us.
Exactly.
But things like that, we kind of do trial and play around with settings. But I would always say,
maybe
start
80%.
with your presets. The thing I play around with is intensity. So if it's more acute pain, like you just want to get that pain reduction, I'll switch it to 100% intensity, and play around with that. But general presets, I don't play around with too much.
Yeah. Quick answer to that one is, I at the start made a lot of mistakes by going outside of what they suggested, and I would not do that again. 80% of time, I think that pre-settings are good. If you want to be cowboy and have a hit and miss, that is completely fine. It also depends on how close you are with your patients and how you can deal with these things not working. So I would say safely 80%, and then you can go a little bit outside of the stuff if you want to be safe. But this laser absolutely provides you with so many options that you can play around, but sticking with presets,
I think just as to reinforce that, Pavle, is that all of the presets in the device are based on their scientific research.
Exactly.
And so they're connected to the pathology that you're trying to treat. So there's no reason to play around with those for conditions that are clearly identified. So that's one thing to keep in mind. You can have absolute confidence that that is the best setting, and it's based around the joules per centimeter squared, the dose that you're giving, and so you can have confidence that's the right thing. The other thing to keep in mind with playing around with the settings is that more does not necessarily equal better. So you might think, okay, I'll put everything up really, really high because I've got a big problem, and that's going to work. That is totally the wrong approach, because oftentimes
very good point.
It can be less, it can be just a small dose that is going to be the thing that will treat that particular problem. So, and the third thing, I suppose, is I do agree with you. Once you understand the system and how it works and what it means, then by all means you are in a a competent position to start to vary it. And always the device goes back to the presets, so you can't go too wrong.
Yeah.
Okay, we better move to the next one, Wendy.
Question, Chris Wheeler, hello, thanks for your question. I'm not sure what profession you're in, but have you ever had a case or cases for which laser has either not worked or not worked as well as expected or as well as the patient had hoped? Do you have thoughts why those outcomes happen? Whilst a crude statistic, what would be the percentage breakdown of levels of success? And thank you. I will say yes, there have been times where laser hasn't worked. Do you know why? One of the main ones is when I wasn't confident in my prescribing, and I said, look, just give it a go, try one, let's see how it goes. You don't get any changes with one laser therapy. So once I
mean, you mind, but you don't want to bet
or
everything
very,
that is like,
very little. If you've got any kind of condition,
Exactly.
one treatment of anything is not going to make a big difference in the scheme of things. So I found that unless I'd prescribed or was told them this is what you're going to need for your therapy, they didn't follow that through, it wouldn't quite work as well as I hoped. They would get some changes. They may attribute it to some other things like, oh, because I stretched on the weekend, because I did this. So generally I'll say, unless you follow, create your treatment plans or how much you think that condition needs, you're not going to get the results you require. And I think that's the general rule. We also did a lot of experimentation. For example, I had a patient who had chronic sinus infections. Every 2 weeks he'd get a sinus infection. And I said, look, this was our urges. I said, look, let's try laser on your sinuses. His sinuses cleared up. He hasn't had an infection in 3 years now, okay? And he was getting them every other week and on multiple medications. We've had another patient come in with a similar thing, and we tried the laser on them. It was a bit more of a sinus occlusion. We weren't able to get that change because I don't think we treated along the same lines. Now, that's the type of stuff of the more experimental stuff that we weren't able to treat. But when I'm talking musculoskeletal injuries, tears, swelling, it pretty much always makes an improvement as long as they do the treatment plan.
And I think that is the biggest thing, their mindset, right? Or they will do once or twice and then just like, wherever. And that's really annoying because not that you lost the patient, but that patient lost the faith in laser, right? So
the biggest downfall of laser is you don't feel anything happening at the time of therapy. And I joke around with patients. I had a new patient in today with radicular symptoms down the leg, and I was wanting to apply laser at the nerve root. And she said, oh, is it on? I said, oh, yes, you don't feel it, it's on. And I go, I wish there was some heat or some little bit of burning sensation so you could feel like something is happening, because as clinicians, as you touch people, there is the, the aspect of something's happening. You do a trigger point, there's some pain, you might do an adjustment, they feel a movement. You see that there is a change that's happening, whereas laser, you don't see it. So it's your faith, or in a sense, that, hey, this is happening on a cellular level and I'm going to get those changes. And once they see the swelling come down and the pain go, that's an easy sell, but it's initially a little bit harder that way. Paula, can you recall any cases where the laser didn't work?
So I think that's the really big one where people don't follow a treatment plan. Usually 2 times a week for 2 to 3 weeks, it's a pretty good time. Of course, if somebody is having issue for last 20 or 30 years, right? You have to sit and explain to them that nothing is going to change like in 2 weeks. So then you have to say, hey, look, what you want to do is we want pain reduction, right? That comes first, and then comes routine, like between 40 to 60% we expect pain reduction, right? And after that, we have other steps. So many times where people just jump in, try it a little bit, have some pain reduction, then jump back, continue with their gym, continue pushing hard, and things not really settling. There's a time when people would just drop off and we would have a case unresolved.
I'm just looking through my day sheets and looking at names that stick out, and I can't see anyone that we haven't had improvement with laser.
So to summarize this question, yes, it can come, but it's mostly based on how well they're sticking to the treatment plan, how well you are sticking to the treatment plan of the laser, and are you sticking to what they say it's working. That's muscle, joints, tendons. It's absolutely beautiful for that. And we really didn't have any failures where we kind of like, sorry guys.
The question, it seems like Chris loves his statistics. What would be the percentage breakdown of levels of success? It's a really hard one to answer. I'd say it's
I would say between 75 to 85% we have 100% success.
Okay.
And then I would say that maybe we have around 25% where people are okay, but like there are multiple other complications. They're constantly
systemic
hitting
stuff
at it.
Mm-hmm.
And we're like, look, this seems to be that requires more treatments. And at that stage, they have to choose.
As
yes.
Well. Yeah.
And sometimes they're like, look, we're happy to continue and pursue, or like, look, we're going to look somewhere else.
We should be careful of the time. What is the cost for laser package session? Do you want to answer this, Catherine?
No, if you want, well, I guess we just did a survey recently and we found on average $70 was the average cost. It cost, there were some that wanted to charge more and some that were less, but that was across all our MLS laser owners. Let's just go through these a little quickly, Lindy.
Yeah, sorry,
sorry guys, we keep talking.
Oh no, it's good. It's all good.
Hematoma in a thigh, I would start with 6 as the offset, and then assess from there. Usually, you'll be talking to the patient the whole time. You know, is it getting better? What are you noticing? If you're noticing,
also depends what really caused it. If they want to train and if they want to push their body, of course, you know, 6 is going to help you, but you need a long-term maintenance to get this under control. So keep eye on that. That sometimes they just want to train.
I find acute injuries require about 6 to 8. Anything more chronic arthritis, you're looking at 10 plus treatments or more management of that. Great presentation, Bronwyn. Hello. In answer to Chris Wheeler, my Melbourne colleague, in my own practice, I have 90% dramatic results. I won't read that. You guys can all read the questions there. Fantastic presentations from Michael. Thank you. How do you, some clinicians new to PBM worry that laser will take away from what they do. What's PBM? Does somebody...
Photobiomodulation.
Okay, sorry, I didn't realize. Sorry.
And this is a common one, Lindy. You know, people worry that they've already got a way of doing things and laser's going to interfere with it, or how are they going to schedule it in? How are they going to still be efficient?
Okay, so it says, have you found lasers adjunct to what you do? It's part of what I do now. Exactly. I'm a really confident clinician and in my skills, but that doesn't mean that something's not going to help me get better results. That's right. In my other practice wins, I don't have the laser, and I see that I would get probably some better results if I had the laser. I can still treat effectively without it, but I think it just makes a huge difference that way. Also, how many patients like to relay other treatment paradigms back to their GP? Have you had interaction feedback, positive, negative from GPs? You know what? We send letters back to our GPs, especially if they're coming for enhanced primary care. And I'll write a little thing on the bottom of laser. This is what laser does, and send some clinical information. I've gotten some referrals back from them. I've had feedback for that one doctor spoke to his patients like, how does that even work? Because both the mother and the daughter were seeing us. One had a fractured ankle, our mother had severe arthritis, and they both found laser beneficial, and the GP said, don't go and see that because that probably doesn't work.
And Lindy, we have got some GP owners of this particular MLS laser. So if anyone wants to find out more, just get in touch with me and I can easily get them to speak to other GPs.
There are some GPs that are very positive, but you know, I guess the less you know about something, the more voodoo it seems and skeptical you are. Exactly. Once you show them the signs, I think it makes a difference.
Exactly. And when they start, we actually have quite a few actually GPs now. They are more willing to do that, and we start breaking through the ice, which is absolutely beautiful. I think there was a little bit of the comment here that absolutely is correct, and that the laser treatment builds on itself. So in the first treatment, you know, it's great, but you keep adding, and that's why we want twice per week for 2 weeks or for 3 weeks, and that absolutely creates so much more results than having the same amount of treatments, just spread it around. And I love to explain it to our patients. I'm like, you're not going to have more treatments, but you're going to have better results. And they're absolutely loving that. And that is a very good point. Thank you for
made some really important comments. Perhaps mention the laser keeps working between treatments. We usually tell our patients within a couple of hours, you'll start to see some changes. You'll feel some changes because of the change of energy within the cells and mitochondria. Exactly. It doesn't happen right away. That energy
Well, it's like with
transfer
peel, it
change
takes a
starts
little
to,
bit time to
yeah,
like.
to actually kick in. So
Yes.
that's a really great point there.
Although there is also, when we're dealing just with the pain, laser can do this.
Laser can switch on.
Absolutely.
Change the pain receptors,
Absolutely.
barriers.
Absolutely. So we see, like, look, questions are keep coming. Catherine,
Okay, thank you. And there's a couple there, Betty, on,
yeah, or when we to start, we're very happy.
There's a couple there on lymphedema, and again, we have very good results with lymphedema. There's a special setting just for this, and it's a fairly straightforward treatment with outstanding results. So listen, I am going to wrap it up there, and thank you very much once again, both of you, for taking the time tonight. And
it's our pleasure.
You can just see there's so much more to talk about. So I hope you'll come back another time, and maybe we can have a panel discussion and
happy to do that.
Open it up a little bit more. But thanks everyone also for those questions. They were really, really great questions. Show that you're thinking about it. If we didn't answer any of them, please send them to us, and we'll be in touch after this and send you a link to this presentation so you can watch it again. We'll also send Lindy and Pavle's contact information, so if you want to get in touch with them directly,
absolutely,
and ask them sort of more detailed questions. So, okay, thank you so much, and we'll be in touch.
Thanks again.
Thank you. Have a nice evening.
Good night. Bye bye.